right. Hey, gang. Hope you're all doing well. So, we're kind of in the middle of a marathon training series. I've been doing a lot of videos on marathons, certain milestones, and 6 key workouts to help you get there, strategies. I hope you're enjoying it. If you are, I hope you hit the thumbs up. And if you're not subscribed to the channel, I hope that you do that, especially if you're a coach or an athlete. I've got 400 videos for you already on this channel. I'm going to continue to add them. But today's video is of very high importance, and I wanted to bring this up because this is a common injury that takes place, particularly when you start training for longer races. Okay, it's runner's knee, and you may be familiar with it, you may not be familiar with it, but it is a common injury that happens. Okay, not so much when you're training for short races, even though it can happen. But as you start increasing volume and training for longer stuff, it can become a frequent thing. So there's a lot of things I want to talk about in terms of identifying it, what to do, how to treat it, how to prevent it from happening either again or to begin with. So runner's knee is a common and frustrating issue. It can be one of these annoying knee pains, okay? And it's essentially a damage or a softening of the patella, which is the back of your kneecap, okay? And not behind the knee, but the back of your kneecap itself. Okay, so again, the pain and swelling can be very common as side effects. And again, the combination of the two can be very annoying, and it can really affect your training. So I wanted to talk about this today. It happens most frequently, most commonly with females. And this is right from Harvard Medical Studies and stuff like that. So it does happen most commonly with women. It usually requires an X-ray or some kind of imaging, like an MRI, to identify and to diagnose it. But it can occur in most everyday activities as well. Okay, but most predominantly running, of course. So again, there are some things that I want to make sure that you know about if you don't already. Now, let's talk about how, where, and when. Okay. Generally, this can happen when you're walking, running most specifically, sitting, standing. There's a lot of different movements when you're going up and down, steps, squatting, or even sitting with your knees bent for a long period of time. So if you're working at a desk and you happen to have runner's knee, this is where it can become most frustrating, okay, and most uncomfortable, I should say. So these are things to kind of look out for. And when can they happen? They can happen at any point in time. Okay, but again, if you're training regularly from a marathon, there's some things to keep in mind, like good sleep, good nutrition. Those are paramount to not only keeping you healthy, but helping to um, minimize the risk for sickness and injury, or both at the same time. So now, some of the causes: kneecap trauma of any kind. Okay, overuse is a common overuse injury, and again, overuse tends to be more frequently when you're training for the half marathon and the marathon as compared to a 5K. So that doesn't mean you can't train for the half marathon and the marathon. It's just things to look at into your training, how to make your training a little bit more efficient. And we'll talk about that. Okay. A poor stretching routine. And this is one reason why on my channel, if you haven't seen it yet, personally, I'm a 2 decades long musculoskeletal therapist and flexibility technician. I'm certified by Jim and Phil Wharton of Active Isolated Stretching. I got certified in 1999, and I've been using it by gospel. I'm also a longtime martial artist, so it's helped me with martial arts and running. I'm a former competitive runner and a current coach, so it's helped in a lot of ways, and it's a very running sports specific stretching routine. So please take a look at the videos I've got. I take you through a full stretch routine, more specifically your calves and other areas, your Achilles, where runners can find issues. Okay. But a poor stretching routine can be one of the causes. A dislocation of the kneecap, of course, can be one of the causes, and even tightness and weakness in the thigh muscles. So functional strength training is a key too. Doing a little bit more of a running specific or sport specific strength training routine, and it doesn't have to be overwhelming. But if it's more running specific, this is another thing that can help, and we'll talk about that in a little bit too. But issues like flat feet and even a lack of a pre-run warm-up. What do I mean? Well, a stretching routine, an active stretch routine, not necessarily a static stretch routine, because static holding for a long period of time doesn't necessarily warm up the muscles, especially in cold weather when you're training. So that's an important component as well. But these are types of causes that can lead to issues like running knee. Okay, now treating it, like I said, flexibility, an active stretch routine that's in your sport and running specific would be wise. So if you take a look at my videos. If you have questions, reach out to me directly at blackbeltrunningcoach@gmail.com. I can do another live stream in terms of taking you through a stretch routine if you'd like. And that's no issue at all. But leave questions in the comments of the running videos themselves. I'm happy to answer them. Okay. But not only should the stretching should be functional, in my opinion, but the strength training should be functional as well. Running specific, individual leg rather than two leg extensions and leg curls, maybe individual leg. Because if you have weaknesses in the muscles, it's important to kind of balance them out as best as you possibly can. Stuff like that. Okay. Rest, incorporating rest into and that's not only a day off of running, but that's also including sufficient sleep. Okay. Especially again, when you're training for a long distance race, resting is absolutely paramount. It's just as important as your training itself. Okay. You can also do a low impact and alternative exercise like swimming, biking, things like that. If you have swimming, available to you, pool available to you, it's not impact anywhere at all in the knees. So it's a great way of um, an alternative cardiovascular exercise while also getting essentially resistance training at the same time with the swimming or pool running, things like that. So compression, doing it in a way that doesn't affect other areas of the knee, like the lower part of the knee. So proper compression and even elevation at night, keeping the leg elevated above the heart. So and it's to make sure you're stimulating good blood flow across the body. Now, preventing it, here are a couple things too. Like I said, staying fit is important. Okay, to making sure you're not deviating too far away from your training, particularly if you want to run another race at some point or do something else. So, staying fit and healthy is, to a degree, is important. Stretch, stretch, stretch. I cannot emphasize this enough. There's so many folks that have issues, particularly running, because of lack of flexibility. And the stretching routine doesn't have to be a long period, a long routine. Like my stretch routine is 10 to 15 minutes, and you feel a heck of a lot difference. And let's just say it's a difference. Let's say you go out for a 10-mile run, and sometimes it takes 4 to 5 miles just to get loose and warmed up. This active stretch routine, you feel good pretty much immediately at the door, and you're running more effectively. And this is why, if you look at my training programs, particularly for the half marathon and marathon, I incorporate speed fartleks. Okay, because I want your running posture to be good. Okay, and speed and running posture is paramount to training for the marathon and staying healthy, as is a flexibility routine, which will help you benefit more from speed fartleks, which will help you benefit more from the longer stuff as well. So they all complement each other. How you do it and when you do it is up to you as a runner or an athlete or even a coach. How you prescribe it for your athletes is up to you again. But these are things that I've seen from experience that I hope that you at the very least consider. So again, staying fit and stretching is critical. And if you're going to increase training, whether it's intensity or volume, do it very gradually and give yourself or your athletes time to adapt to it. That's what I call periodization. I talked about this ad nauseum in my videos as well. Taking about 3 to 4 weeks to adapt to a certain type of training stimuli before making changes again, rather than increasing every week and not giving the body a chance to adapt. Also critical. And lastly, good shoes. If you can afford to get 2 pairs of shoes and alternate them, that's the most ideal situation, because the shoe surfaces and the cushion wear out a lot quicker if you use the same shoe every day. And obviously soft surfaces, if you have them accessible to you, even if you're training for a marathon, which is on the pavement mostly, if you can get to a park and do rolling long runs or in the dirt and asphalt, anything that's softer than pavement will be much forgiving on your legs, will also help in your recovery as well. Obviously watching for footing is key, but good shoes and soft surfaces is another 2 things that I can't emphasize enough. I really, really can't. So again, these are the things that I think are critical. Identifying, again, runner's knee, figuring out whether you have it or not. If you get it diagnosed by a doctor or a medical specialist, they'll obviously tell you as well. And what do you need to do to make sure that doesn't happen again? It doesn't happen to begin with. Put yourself on good footing to begin with. But especially if you just train, if you're couch to 5K, couch to marathon, it's little things like this that add up that make the difference, that can help keep you healthy. So I hope you found this helpful and enjoyable. And again, if you have questions, reach out to me directly, blackbeltrunningcoach@gmail.com, or just leave comments. Leave questions in the comments of the video, and I'll be happy to address them. I also have memberships available, so if you want customized training programs, take a look at that. It's level 2 is the name of the membership. That's the one you have direct access to me for Zoom meetings and monthly consultations, and we can customize your training or the people that you coach. You can do whatever you want. So I hope that you'll consider those as well if you want a little bit more specific training. And they're very, 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 very affordable. So a lot less than folks think. So take advantage of it if you want to do that as well. But let me know what you think of this video. Share this with other runners and coaches, and have a great weekend and a great week. And I'll talk to you next time.